So, little backstory, like my nursing communication, I actually started this project in med-surg because I was tired of having a report take an hour every day and I was never getting out of work, so I was like, there's gotta be a faster way. So that's how the whole thing started. But then when I got into the project, I ended up figuring out that that's actually not the biggest problem. The biggest problem is all these errors that happen in communication or miscommunication between departments, nurses, etc. So that's where it all started. So it ended up being something that I was really, really passionate about. And so, per objectives for Riviere, so at the end of this presentation, observers should be able to define communication and its importance in nursing, summarize ways to communicate with other healthcare personnel regarding patient handoffs, and describe what can be done to promote patient safety in nursing handoffs. Okay. So, communication itself is essential for all patient care. Miscommunications account for 80% of sentinel events in the ER alone. And as most of you know, I came from the ER, so that's where my project started focusing. And then when I transitioned to urgent care, I tried to like branch out and be like, how can this integrate into what we do every day? So as much as 30% of miscommunication between providers was leading to adverse events in the ER alone. So the safety of the patient is at risk in breakdowns in communication. And there's actually no standard in which to communicate about patients among nursing and other hospital personnel or, like practice personnel. So when patients are handed off from one provider to another, that's when miscommunication and breakdown may lead to errors. So I actually, and then this is how I integrated it into urgent care and our practice itself. In a most recent survey regarding results conducted by staff who work in this facility, the #1 complaint in our department was poor communication between departments. One of the biggest complaints of nurses in the urgent care department was that patients were sent to urgent care that were too sick to be there or not enough communication. And the urgent care nurse to accept this patient. Some of this is due to the fact that there's no room in the department schedule for that day, or that the staff feels that there more care can be given in the department. Other times it's simply that the patient or family is refusing to go to the ER when that's where they should be going. If the patient is too sick for urgent care and is ultimately sent to the ER, the patient now endures that additional cost. Furthermore, communication between departments may help the patient faster if the patient needs labs or imaging that can be done prior to sitting in the waiting room for an unnecessary time. Epic itself has many tools that can utilize communication between the departments, as well as phone call to the nurse or a nurse in person. Thinking about what the patient can actually needs and what we can do as a team, we can make that happen. So, like sweating. I don't do well with with stuff like this. So this is actually our handoff. Christy provided this to me. And until Christy provided this to me, I actually didn't even know this existed. Which is kind of sad. So it's like a standard SBAR and reasons to make like a safe transfer of a patient from a department upstairs or downstairs to another department. All right, so that would be an SBAR. So there's different types of SBAR. We could do bedside, EMR, taped, iPass. Providers usually use iPass. Okay. So in 2009, it was discovered that there was no current research studied on patient handoffs that were effective. Cohen and Hillsgroff actually conducted this study in 2010, which is 9 years ago. And nursing has been around for how many years? Mm-hmm. So that was when the first study was conducted and said, hey, we don't really have a good way to communicate. And SBAR has always been there, but is that the most effective way? So they had found that that was not the most effective way, and that there wasn't really a good handoff. So the Joint Commission recommended that inputting a standard approach to handoff communications, including the opportunity to ask questions. There's also no real definition of handoff. So their research came up with a clearer definition. So they came up with the exchange between healthcare professionals of information about a patient accompanying either a transfer of control over, responsibility over the patient. So that could even be between provider to provider, nurse to nurse, EMS, whoever we're handing this patient off to. Right, so tools such as SBAR have been used in nursing in the past. However, research shows that there's more effective ways to communicate. Bedside reporting and the use of the EMR tool are among better ways to communicate. And bedside reporting in urgent care or in this setting is a little bit different, but you're still able to like go into a room and communicate about that patient to the patient and that family about what the needs are and what needs to be done. So I have two scenarios. And one's a good scenario, one's a bad scenario. And the good scenario is there was a 65-year-old female, had a history of a hip replacement. She was in PT at the time. It was brought down to urgent care. PT brought her down and said, something's not right with this patient. She's got like this hip pain, it's new hip pain. I'm worried that she has a PE. We're like, oh, okay, well, thanks for telling me that. Like that's totally something that we need to be worried about. So the patient was able to get an ultrasound. The report was done in person. That PT came in down and actually found me as a nurse and said, I feel like this is something that you guys need to be worried about. So we said, okay. So we got her into an ultrasound, and that patient was cleared of a PE or DVT, PE, whatever, cleared of anything. So, but that was, a good scenario. The bad scenario, unfortunately, 17-year-old female, she was taken by wheelchair by her husband from another department and just kind of left in the waiting room. Her vital signs were not stable. Her O2 was low in the 80s. She was on oxygen in the waiting room. Our receptionist came and found me and said, Colleen, I think you need to come look at this patient. Like this is not appropriate. Like this patient really needs your assistance right now. There was notes in the Epic that the vital signs weren't stable before. The patient was having a lot of problems with, waking, something like 36 pounds in like a month or so. So no SBAR was given. No nurse to nurse. The patient ultimately went to the hospital and was put on hospice. Had that been a nurse to nurse, that probably could have gone into a different scenario. Maybe that patient needed to go right from that department to the ER or something along those lines. So that's what we come up with, bedside reporting. So bedside reporting, or we can call it nurse to nurse here, etc., reduces sentinel events, reduces some of that miscommunication. You're right there talking to that nurse, that MA, that provider. You're also in the room, that family's there. That family can ask questions. What's going on with grandma? What's going on, what's the outcome of this? Because they might have more questions than we do of each other. So it also decreases the need, we don't have a shift report here, but it's gonna decrease that need to say the same thing over and over and over again. I know in my previous employer we had Epic, or we didn't have it, we had Cerner, but there was an EMR tool built into Cerner, so we could just, when we're doing a nurse-to-nurse report, it was right there, everything that we needed for that patient, built right in. Epic has the same thing. We can have that report and be like, hey, we can open up the computer, in every room we have a computer or a laptop that we can bring in there and say, this is what's going on with this patient. Do you have questions? What can we do? And this was echoed in several studies. The use of bedside reporting with an EMR was the most effective way and it reduced the most errors. All right. So essentially, this is how we did bedside reporting at the hospital that I worked at before. So instead of being an SBAR, we acknowledge, introduce, duration, well, how long is the patient in here? Explanation, and then thanks. Do you have any questions? All right. So slogan: communicate better to save lives. All right. So we're going to be using handouts that require information about a patient that is currently relevant to their care and condition. Many handoffs do not include pertinent information and often include jargon, personal judgments, and non-essential information that's time-wasting and obstructive to the patient and the situation. So not adding that medical jargon when the patient's there. They don't understand what we're talking about. Then they have more questions. Then we're spending more time answering that question. You know, instead of saying, oh, we think your mom has a DVT, like, oh, we think your mom might have a blood clot in her leg. Something that's simpler. This is also time to find out any patient needs. You know, give me a drink of water. Or are you concerned about something that we have done, something that we said today about these tests? There's no limit or restriction, however, remembering to hit on the key points that are pertinent to the patient, the shift, or the needs at the time of that report. Like I said, this kind of like encompasses like just the hospital as well. Okay. So the challenges. So the biggest challenge that I found when I was, doing surveys and asking people is that human challenge. Nurses don't like change. Nurses don't want to change. They're like, we're set in our ways. We don't want to do this. Like, this is how we've done it for 20 years. This is how I've done it the whole time I've been a nurse. So a lot of times, even in all of these studies, nurses would try this new way out and then revert back to the old way. So the other challenge would be knowing what a good handoff is as opposed to a bad one. And this was really hard when I did research in new nurses to old nurses. Old nurses, they're in their old ways. They're like, this is how we hand off, and this is what we think is important. And the new nurse is like, wait, I have like 10 other questions. Like, tell me what's going on here. And they're like, well, you're just wasting my time. So that ended up being a challenge, that nurse bullying and all that other stuff. But that's one of the biggest challenges. So overcoming something like that. The other one is having patients in the room, family in the room that maybe doesn't need to hear what we're talking about, or is kind of maybe has some mental health component, and that could be a challenge as well. How do you overcome that? So, all right. So my goal of this project was to collect and review data with regards to nursing handoff. If we were to implement, some of these strategies in our care, we can improve patient safety overall. We could use a handoff tool in Epic, and we could transfer care. In addition, we could follow up with a telephone call or a personal handoff. If a patient needs to come down and they need to be with a nurse, have that nurse do that handoff. Or, hey, give me a call. Like, I have this patient. I'm not sure if they're appropriate for urgent care or appropriate for family or whatever. What do you think? And then you could use, our form of SBAR or another communication tool that we have in Epic. And the nurse could voice any concerns at the time of handoff. So to improve overall communication between nurses in the outpatient setting, we need to utilize the research and make necessary changes to make it effective in this setting. Using a handoff tool, either on Epic or, and even a paper one if we needed to do that, could help improve communication between departments. And I think that that's where we're lacking the most right now. So, even something small like this, we could, improve the communication through the whole building. So the use of what we'll call bedside reporting, in addition to the use of a handoff tool, could improve communication, collaboration, and patient safety. So that would be the tool. And then, like I said, Epic, nurse. Questions or ideas?
We could probably make that a smart phrase.
It is a smart. The SBAR is a smart phrase? What is the smart phrase?
It's handoff department, handoff SBAR.
Okay.
I'm not sure if it's like system or if it's just like a. Because then we would have time, details, and people involved.
Mm-hmm.
I agree. I think that would be awesome.
Yeah.
Like between departments, or like making it mandatory if we have a patient that we know is unstable, like call.
Yeah.
or come in and like find a nurse. Like, I know that our department's crazy, but you could always find a nurse. Like,
Right.
Like, hey, come here. We need to come see this patient.
I'm surprised with all that. So SBAR isn't necessarily evidence-based. You said there wasn't like research to
No.
support. Interesting.
Nope.
It's just what it
It's
feels
what we-
like. I guess it's been 9 years, but it feels like the thing.
Yes.
It's pretty ubiquitous now in nursing, I think.
Yep.
So,
And it's not. It's
or probably not just nursing.
And
but
it's not the standard, and every SBAR is
Huh.
different. Like, our SBAR says situation, background assessment, recommendation. But what's my recommendation as opposed to what's Christy's recommendation? Or what's, Dr.
Right.
Young's recommendation? Like,
Right.
there's no real standard when it becomes that. And then there's like, all right, so what do I think is important as opposed to what Christy thinks is important? important,
Mhm.
that Cheryl thinks is important.
Mhm.
So, and I remember coming across that in like med-surg, like I would literally be in report for an hour every day because the old nurse was like, well, what's their past medical history for the last 20 years? And I'm like, I don't feel like that's important. Like, I'm an ER nurse. Like, they didn't die this shift. That's what's important to me. So, like, do you see what I'm saying? And like,
Yeah.
and so that's why it becomes like, you know, and if it's all like kind of in Epic and we're able to both look at it and be like, okay, I saw that, she saw that, we agree that those are both important things, but like maybe this isn't as important. But it's nice that we have that information.
Right.
Now, you said that there was a tool in Epic
I'm-
to use a handoff
I'm
already.
pretty-
Is there,
well,
is
well,
there
we
like
can-
a section, like a tab we can pull in?
I am like,
You're gonna make me start clicking stuff.
but I feel like I don't know that there's a tool per se, but we have the ability to communicate with each other through Epic, like instantaneously, like .SBAR or whatever it is, and then we can communicate with each other, like, Christy, I wanna send this patient to family, or I wanna send this patient to you, what do you think? You
Other
know,
offices use Trillian too.
Mhm.
oh, I don't know how to use
We use
Trillian.
Trillian a little bit here.
Yeah,
Yeah.
I'm not, people use Trillian because it pops up, you,
Yep.
it
Yeah.
catches your eye right there.
What is it though? Is it like
It's
another?
like an IM, it's a secure IM
Yeah.
feature, so,
That'd be awesome. I didn't even know that we had that ability.
yeah, it comes up when you log in. It just
Yeah, but I
says-
don't know what it is.
Yeah, and I know they're piloting right now in Family Up Here this instant message, secure messaging within Epic. Heather Lennon. So there's a new. I know it's popped up on mine with a little. It has one of those little those speech bubbles or
Mhm.
something. So they're piloting it
Within Epic itself.
within Epic to see. I
So
know
that
that.
would be perfect.
Yeah,
That would be awesome.
So
That would
they're
be
piloting
Or
that.
somebody urgent needs to be sitting at a computer to see it, but.
And I'm sure it's going to be
Yeah.
something like so it's not like pop-up fatigue. So it's like, okay, there's certain things, like really important things that, other than that, like, you know, I know a couple of the providers were on, you know, doing their notes and some of like these back and forth messages coming up. And I know I remember that from Trillian because I'm on a couple of groups when I work up in Lebanon. It's kind of like DART, like the helicopters, you know, it's like, you know, can you do this one, timing, and then there's like, thank you, you're welcome. And each time somebody says anything, it like
Yeah.
pops up on your screen, so it gets a little, so that's another thing to think about, like that
Right.
kind of like messaging fatigue.
Pop-up fatigue, I like that
Exactly.
term.
Well, you know,
Exactly.
also in the
Outlook does that to me.
in the hospital, like we had Vocera's. I don't know. Do
Yes.
they have Vocera's at Dartmouth?
I don't think it's Mostera, but same type of,
Like
yeah.
over here on your, you know, like, hey, find Cheryl.
Yeah.
Oh, yeah, yeah, yeah.
And
yeah,
like,
they
and then
do.
and then you're like, hey,
I
can
thought
you
you meant the
talk?
phone, yeah.
Oh no, it's like a little
Yeah, you can find out.
walkie-talkie that's like connected to you all the
The
time. Not that I think
hospitals
we
have
need that here.
So I think it's interesting that they use AIDIT as a handoff communication tool.
Yeah.
Because that's something that's been our kind of standard of communication, you know, back
And
in
it's
the
with-
Studer group days where, you know, we just, with patient
With
interaction.
patients,
Acknowledging
right.
the patient, introducing yourself, telling them how long it's gonna be.
Yep.
Thank them for waiting. You know, and it goes a lot with, you know, a good handoff is, you know, ties into the managing up part of
Yeah.
AIDIT. This is my friend Cheryl.
Yeah.
I'm going to bring you to my friend Cheryl. She's going to take care of you from here. I'm going to take a minute to explain to Cheryl what's going on. You know,
But how
Yeah.
often are we using that in the grand scheme of things? Like, yes, in interdepartment, I feel like that probably happens all the time. That probably happens up in family all the time. You know, I know we do that in urgent, but between the departments, like, and like you said, our number one complaint was that we're not communicating with each other. And I feel like patient-wise, that's huge. Like, that's how we're gonna improve everything. Right, right, and like Press Ganey, I don't know if we do Press Ganey here, but Press Ganey in the hospital, like that was the number one complaint at the hospital, that the communication between each other. You know, and like, I was in the ER and we're the redheaded stepchild in the hospital in the ER, and like, it was always like, oh, the ER sent us this patient, and like, they didn't, like, so, it's like, okay, but you need to be able to communicate with each other, because the ER sends you all of the patients. You know, like, and then you have to be able to communicate with, like, you know, the heart unit, as opposed to, you know, they're the step down unit now, like, you have to be able to communicate with that person, or, you know, that unit, so. But, okay, so, I have to have you guys fill out things, and I only have 2, Cheryl, so we'll have to make a copy and fill these out, but, okay,
Sure.
it can be done.